Natalie. I'm the owner of Body Strong in Burien. As a small business owner, you really wear a lot of hats, and it's a joy, but sometimes it can be stressful. But something like the Comcast Rise grant really helped us. It gave us 3 iPads, we got 2 laptops, we had a desktop computer, we got free internet for a year. Small businesses should apply for the Comcast Rise grant because, to be honest, the application process is very simple. Grow your business and apply today.
How many of you in the room have used an AI product like ChatGPT, Gemini, Copilot, something, Claude, etc.? So many of you, not all of you. Okay, that's fair, this is good. What my hope is that tonight you get a lot more information on using these things in your life or in your work, and that way you make the judgments on your own. Because the thing about AI that's really important is there's no right or wrong answer right now. Any absolute a person tells you, whether it's myself who work with training AI models and deploying them to customers, or whether it's these fine people who work with them all the time in specific industries. Right now, we're very early in the game, and everything we know about AI could be 100% true, 100% wrong, but probably it's somewhere in the middle. So we all have to formulate our own opinion and our own point of view on this, because it will come up over and over again for the next 10, 15, 20 years. All right, so let's start with probably the most interesting question that we get all the time. And maybe we will just kick off with introductions before we get into that. Do you want to start?
Yeah, hi, I'm Tom Sebastian. I'm the CEO of Compass Health. We are a community behavioral health organization serving the 5 counties of the North Sound region.
Hello, my name is Clara. I am a general pediatrician by practice working at Seattle Children's, and my day job here is a Chief Medical Information Officer for Seattle Children's. Thanks.
Good evening, everyone. My name is John Scott. I'm an infectious disease physician. I practice at Harborview, and I'm the Chief Digital Health Officer at UW-Medicine.
Hey everybody, my name is Brian Bott. I'm Director of AI and Data Science Partnerships at the Fred Hutch Cancer Center just across South Lake Union here. I like to joke that I'm a recovering statistician, but have spent the last 2 decades sort of working at the intersection of data governance, technology development, and biomedical research.
Very good. So we're just going to put that microphone back up to your mouth, Brian, because this first one's coming at you, okay? So what I would love for you to tell everyone is, in your point of view, what is the difference between a consumer AI for all, like ChatGPT, a Copilot, a Gemini, Claude, name the random thing du jour with a horrible name. What is the difference between that and something that's what we would call a medical grade AI product, something that's actually useful for medical people?
Yeah, well, I'll start by saying I do not speak on behalf of Fred Hutch, it's in particular as it relates to anything that would be a regulated device. However, with that said, AI is a tool, and in fact, it is not just one tool, it is many tools. And so when we talk about consumer grade AI applications, such as ChatGPT or Gemini, part of what was so interesting and what sort of captured everybody's imagination is just how accessible it was and how easy it was to interact with. And what we're seeing now is a desire for similar types of applications to come up in all sorts of very specialized areas. And there are many different ways you can do that. You can take an already trained model, such as ChatGPT or Gemini or many others, and fine-tune it or sort of point it in a different direction that is more applicable to whatever your use cases, whether that be cancer research, cancer care, decision support, et cetera, or you can build de novo models that are only based on data that is highly relevant to your specific area. There's still a lot of questions and changes, to your point, day by day about which one or ones of those are quote unquote better. And I think it'll take a long time for us to understand that. But all that to say, there is a lot of learning that will be done. And as far as regulation goes, the FDA a number of years ago started a program called Software as a Medical Device, which was their, or SAMD, I actually really like the acronym for some reason, software as a medical device, that was their attempt to take what they learned in regulating therapeutics and apply it to things that are more technological that change over time. And so they did a number of pilots in the mid-teens, and now have a full SAMD program that helps guide work that they're doing.
I love that that foundation was put in place decades ago, and now it's extremely useful to have just the guardrails with which to try out some of these new models and tools. So it's not like building a whole program team, et cetera, from scratch. Okay, so the next question, I think this is a controversial-ish topic. How, for any of you actually, how is AI used in healthcare today? Whether we, the consumers, know it or not know it. Anyone?
I can get started. So at UW Medicine, our initial use cases are really trying to relieve a lot of the burden that healthcare providers are experiencing. I think you may have read about like burnout. And if you talk to my colleagues, I mean, one of our biggest complaints is just how much time we spend in front of the computer. I took typing in 9th grade. I can type 60 words a minute, but a lot of my colleagues are like this. They were just spending an inordinate amount of time, finishing their notes. So one of the things that we're really excited about is something called Ambient Scribe. It's basically an AI scribe, and I'm one of the beta testers. I love it. So the way it works is I go into the clinic room, and I ask them, hey, I'm using this new device to help write my note. Would it be okay if I use it? And I get my phone, I open up Haiku, which is the Epic app. I press a button, it records, I put it down, and I talk to them. I look at my patient, and we actually have a conversation like I did when I was a medical student. And maybe I put in some orders, and then we're done. I press stop. And by the time I walk down the hall to the charting room, that note is already written for me. I do a little bit of cleanup, but it's pretty good. It's pretty darn good. So that's maybe one of the most successful uses of AI. We use it for responding to inbox messages. And again, the docs have to edit it. They have to approve it. In the research realm, there's been a ton of research using AI for imaging heavy specialties like radiology, dermatology, pathology. They've been using AI for like 20 years. So when you think about AI, there's three things it does. Number one is it can predict. So we use a sepsis prediction model. I'm an infectious disease doctor, and if you get a really bad infection, that's called sepsis. It can be life-threatening. And the earlier you can identify it, the earlier we can, start fluids, start antibiotics. We've turned that on, and it saved tens, if not hundreds, of lives. So that's kind of like 20-year-old technology. Second thing is classification, and that's kind of like what I was talking about for imaging. And then the third is generative AI. That's the note writing. So I think we're kind of just in the top of the first inning in terms of what we're using. I just want to tell you, we're really trying to be as transparent as possible with our patients and when we're using it. So we have to get consent from you guys before we're gonna, use that. So yeah,
I'm really glad you talked about this, the consent part. So this matters. Does anyone know what responsible AI is? Has anyone heard of it? Most people haven't. If you work in the space, me, Femi, Jeremiah know what this is because we live in the space. So responsible AI is the practice of doing AI in a way that helps society versus harming society. So every tech company has their own responsible AI guidelines, and we have finally, as a tech people, settled on about 6 that make sense to people. And the first one and the most important one is that one, transparency. You have to disclose to people that the thing that they're interacting with or the thing I'm using right now is AI, not human. You know those chatbots that pretend to be human? We hate those, right? Because it's not responsible AI. So every company is starting to agree that, you know what, we have to disclose the usage of AI. And I think no matter what we do with AI in whichever field, that one is mandatory. That one should be mandatory. In the EU, that is already a law. And hopefully that will become a law globally as well, because that's the worst situation we can have, is people not disclosing, AI giving not good advice, and people believing it's coming from a person. So I'm so glad you talked about this already. Yeah, Clara?
I wanted to add, I think responsible AI is even more important in healthcare when we're leveraging AI in healthcare, because when we talk about privacy, ethical use, all of those things are held to even a higher standard when it comes to your healthcare data, to the way that you're being treated by your physicians and your clinicians. And so we probably all know this, when you're trying to establish a framework to implement AI in healthcare, the most important thing to first establish is the governance for AI, and to make sure that you have a governing body within your organization to look at all the AI use cases and whether they're being leveraged responsibly and ethically.
I love it. So can you tell us about some of the AI use cases that you've seen?
Yeah, so at Seattle Children's, we're doing quite a bit of AI innovation. I think about a year and a half ago, my title has no AI letters in them by themselves, but about a year and a half ago when ChatGPT became really cool, suddenly everybody wanted to do AI, and everybody and their cousins want to account on ChatGPT, and I don't provision those accounts, but then they come to me and they say, we really need to improve patient care using AI here, we really need to improve clinician well-being using AI there. And so over the last year and a half, Seattle Children's has either purchased or licensed products that are readily available out there, kind of like the ambient AI. We've also piloted that here. We've also partnered with Epic, who is our main electronic health record, that are doing a lot of AI work there too. And we've also developed our own AI solutions at Seattle Children's to improve patient care. So one of the most exciting one that we recently did was partnered with Google to do pathway assistance. So over about 15 years in Seattle Children's history, we've created about 70 different clinical pathways that helps guide our physicians and our providers in figuring out what the standard best care, best evidence-based care for each and every condition. And amongst those 70 different conditions that we've developed the guidelines for, we've accumulated maybe 1,500 pages worth of really great content, but then we're basically expecting our clinicians to be flipping through those PDFs, to find what the best way to treat asthma is. But those guidelines are there as a reference, and we're hoping that people will use them so that regardless whether you see Dr. Scott, Dr. Lin, Dr. whoever, you're getting the same type of best appropriate care. So with AI, we've now layered an intelligent agent on top of the 1,500 pages worth of PDF and really great content. And now this chatbot can basically tell the clinician, I have a child in front of me with this, I want to use this pathway. Can you please tell me what to do next? And the chatbot, instead of making medical decisions for the clinician, will help you locate on that clinical pathway and tell you what the next best thing is. So we're really trying to leverage the power of AI and the ability to digest through mountains of data to help bring that information to the clinician.
That is so cool. I may hit you up for a demo because that's cool. Okay, that's cool. Because how many of you are excited to read 1,500 pages of medical information? We just don't have that capability. I think about all the times we did not read that entire document because we just can't. Just the cognitive load and the time needed, but to be able to ask specific questions and be able to prompt something like, tell me the top 5 things relevant to me, a person who's this age, lives here, et cetera, right? I think those are some of the more, air quotes, magical aspects of it. So I love that you've got, this agentic thing that runs on top of it. Okay, so tell us.
Yeah, so
AI usage.
we're really excited in behavioral health at the possibilities of vastly improving the experience of the clients that we serve and our staff simultaneously. So building a little bit on what John was saying, having products available to us now, which in a safe way and governed way, can, in the session, therapeutic session, which might be a mental health therapy session, it might be an addiction treatment session, it might be both in one session for certain individuals, having the capacity for the clinician and medical staff to be in the moment with their clients rather than be trying to type at the same time as they're in session with them, we think is an extraordinary opportunity. These products, of course, then integrate with our electronic health record all the way through the billing process. So it really takes that session, creates a note, which the clinical or medical staff will then edit, appropriately, but that note will already be in compliance with the regulatory and payer requirements. So instead of having staff going home and either typing in session or the alternative being sitting on their couch in their pajamas till 10 at night doing their notes, we think this is a great opportunity to really enhance the clinical experience for those we serve and the satisfaction of our staff. And we have a workforce shortage in behavioral health. It is real. And so we just cannot recruit and retain enough staff. And we think this is going to be a game changer in terms of raising that level of satisfaction to do the work that they went to school to do, rather than be doing all these other things that are either regulatory requirements or payer requirements.
Back to your burnout question, back to statement at the beginning, reducing burnout burnout of course happens when you're doing work that feels completely unrewarding for the amount of effort you're putting in. So I think that's incredible to bring you more presence and less burnout. Awesome. Brian?
Yeah, I'd just like to add on one little bit to that, which you sort of made passing reference to, which is a lot of, well, especially what if some of these generative AI models can help facilitate is distilling information not just to one audience, but to many different types of audiences. And so you could imagine how many people have logged into their MyChart or MyChart equivalent and seen your doctor's notes from a visit. And it's, for me at least, it's often indistinguishable. Like I can't read it, right? Yeah. Because it wasn't written for me. But you could imagine a future, and there are some technologies that are starting to be put in place where you could take that note, summarize it in a way that is more digestible to, whatever the individual who's trying to consume it is, whether it is, a patient, whether it's a caregiver, whether it is, somebody who is an insurance claim. Like all of those speak slightly different languages, and you can fine tune some of these models to quote unquote help speak those languages.
I love that because, first of all, no one can read a doctor's handwriting. Just not to be mean, but it's just true. And second of all, no one knows what these words mean, right? You should have 3 doses of this and 8 doses of that. We're like, yeah, what's that? They're like, it's good Tylenol. We're like, oh, okay, thank you for that information. But I think that part is key, right? Translation, also really important. Okay, so I was doom scrolling this morning, of course, obviously, on Twitter, which none of you should do. And of course, I come across an article because Twitter's gotten me, dialed in. It says AI will replace doctors, and I'm like, oh, I can't wait for that. That's going to be amazing. So I'd love to hear all of your thoughts on AI will replace doctors. Please discuss. Have a fight.
I'm going to start with a funny story. I'm on the AI task force for the Washington State Medical Association, and we helped to develop guidelines. And one of my colleagues told this story where she lives in Bellevue. She lives next to some of the Microsoft guys, and she was hosting a dinner party. And this was about 2 years ago when ChatGPT was coming out, and they were giving her a hard time. She's an internist. And they said, we're going to put you out of work. And they were kind of rubbing it in. And literally like half an hour later, one of the guys choked on a crudité or something like that. And she came right over calmly and performed the Heimlich. And she looked at him and she said, "Can AI do that?" So there's that. I mean, I think that there's always going to be procedures that will need doctors, but there's a famous saying that AI won't replace doctors, but doctors who use AI are going to replace those who do not. So I think we're still kind of figuring out how to use AI, but I don't think the human touch and some of the complexity of what we do is going to be replaced. But we definitely can be more efficient using AI.
I'll add, prior to joining Seattle Children's, I worked in California as an internal medicine physician and as also a pediatrician. And I've been thinking about this question quite a bit. What part of my job is replaceable with the machine and what part of my job cannot be replaced? And so in thinking back, as an example, I see adults a lot that need to be cleared medically for a surgery. For example, major heart surgeries or even simple cataract surgeries. And AI algorithms or even predictive analytics that are looking through the patient's chart can probably tell me better than I can in my head the calculated number of percent that the patient will face a complication during this very simple cataract procedure. And something as simple as a cataract procedure in an otherwise healthy young person is very, very low. But then what AI doesn't know, but I do as their primary care doctor, is that when they're going through their cataract surgery, they're not going to be able to help their elderly parents at home for 2 days, or they're not going to be able to drive to work, that's 3 hours away, and they're not going to be able to use their computer when they're working from home. And so those are the types of things that I know as their primary care doctor, because I have that relationship with them, and I know the family dynamics, and I know what this surgery means to that family, that a machine will never be able to tell. So that will be preserved.
Can I add something? So, in 2017, we had a very small pilot going on for telehealth at our organization. And then COVID came, and then like everyone else, in 30 days, we had to ramp up to have a telehealth capacity for most everyone that we serve. Not everybody, but most everybody. Then as COVID went to wherever it is now, it has been interesting that was really effective, and it was a way to stay connected with people under that circumstance. When the social distancing requirements were withdrawn, 90% of those we serve wanted to come back into the office and see someone. Now, because we're serving people who are processing trauma, they are processing very difficult circumstances they're in, they're processing chronic and severe persistent mental illness, kids and families with really significant behavioral disorders. And so we still use telehealth, but it's a tool. And that's where I think in behavioral health, AI will be a tool that will be great. And it will enhance the experience, again, of those we serve and our staff. But I don't think it's going to be a replacement.
So I agree with everything that was said. I think, again, the human aspects of giving care are the things that I think when you talk to a clinician, that's what they want to get back to. And so any tool that you can give a clinician that allows them to your point earlier, like look a patient in the eye and not stare at a computer screen during a visit, is immensely valuable, not just to the physician, but also to the relationship between the patient and the physician. And so I think we will see an influx of decision support tools that continually make a doctor's life hopefully easier. And again, there will be a learning curve about how you incorporate that into your practice and into the way that you operate. But I think it's a real powerful mechanism by which you can almost go back in time and return to a time where there was not a computer screen that was, even if it's not literally in between the patient and the physician, it usually feels that way.
I love that all of you have said this thing that we as an industry are figuring out, which is AI, the best person that the AI is good for is the expert. Right? So all of you are experts. You're all able to use AI as your assistant to help you do the godforsaken parts of your job, so you can do the main part of your job that you went to school for, that you enjoy, so that patients have more time with you. You have more time with research. You have more time with doing the things that actually move humanity forward versus filling out papers and like making sure you filled out the compliance form correctly. So in this way, this we're seeing across every industry. The expert knows how to use AI best. The non-expert knows how to use it poorly. And that is just the case, right? So when I see people say, I don't need to go to a doctor, I uploaded my x-rays into ChatGPT, and I think I have lung cancer, I'm like, or that's just not a good x-ray, where did you get that? On eBay. Like, don't do that, right? But it's interesting in healthcare, we're seeing the exact same thing. It's cool. So here's something interesting. I've worked in tech, we've all worked in tech now 20 years, more. People hate tech. Yeah, they do. If you don't choose it, you hate it. You really hate it. So how many of you have called a customer service line because something didn't work? Airline, flight got canceled. Okay. How many of you are so excited to talk to the robot? How many of you just hit 0 over and over and over? One guy wanted to talk to the robot. That's it. We got one taker. Who just hit 0? Human, human, human. And then aren't you so relieved when you're like, Delta Airlines, how can I help you? You're like, oh, thank God. My flight got canceled, blah, blah. They're like, everything's okay. Even if it takes 3 times as long, wouldn't you much rather deal with the human at the end of it than some robot who's like, option 1, no, you missed it. Option 8, do you want Espanol? No, please, right? We don't like technology unless we choose it. And that's the thing with AI. And I think AI people, we forget that. We're like, oh, people are going to prefer technology to humans. And I'm like, have you never met a human? Because that has never been true in the history of the world. And I love the telehealth analogy because I did telehealth during pandemic and I was so excited to never do it again. Yeah. I'm like, I don't know if my arm is broken or I just slept on it wrong. I need an actual person to tell me, right? Not a telehealth person. Okay. So these are all kind of the good side. Of course, there's a bad side. What do you all perceive as some of the risks for people, whether it's medical healthcare professionals or whether it's consumers of AI who may use it to do medical diagnoses or whatever it is? What do you think are some of the risks?
Yeah, I'll get started with 2. I think the first is bias. There's a saying, garbage in, garbage out. So, because these models you have to have good data. And a lot of our healthcare data is wrong. I mean, like how many times have you looked at your own record and you're like, I've never taken that medication. Why is that there? I mean, I'm not 6'5", I'm 5'6", So I think it's all about the data. And a lot of times the data that gets fed, I hate to say it tends to be patients like me, white men. And so, that doesn't always extrapolate to certain populations. So we have to be very careful. There needs to be kind of a continued testing of the model. So that's one. And the other one that's kind of emerging is just the cost of AI models and what's the ROI. We're with the kind of the financial situation we're facing in healthcare, that's increasingly a question that I'm getting, like, hey, I got this new tool, and I asked the CFO, can we use it? And he's like, what's the ROI? So I think those are the kind of 2 kind of headwinds we're facing. Yeah, Clara?
The other risk that I would call out, especially for patients, if you're not in healthcare and you're walking into your doctor's office and they're using ambient AI, because that is what we're all using, we're going to all be using soon, is your privacy, the privacy of your data. Because AI now can process, as I mentioned, mountains of data, and a lot of that is yours. You're the owner of your own healthcare data. And so when you're walking into a physician's office and we're using ambient AI, that means we're recording your voice, and AI on the back end is transcribing that conversation from voice to Word document, and then basically extrapolating from that Word document into a clinical progress note in the format that we are used to in healthcare. And so your voice recording is now somewhere in that vendor's hand. And so to be a smart consumer, a smart patient, when AI is leveraging your doctor's office, I think the first question that you need to ask, or if you want to be a smart consumer, you should ask, what is my data being used for and how long is it being kept? Because there are some vendors that will keep them for 0 days or for 10 days for the doctor's clinical purposes, and there's some vendors that will keep them for years. And some vendors use it to train their AI to make it better so that they can sell it back to you and sell it back to the doctors. And are you profiting from it? It's your data, right? And so I think the data use, retention, and your privacy is going to be a really important thing for us as smart consumers of AI moving forward.
Agreed.
I'll just loosely say that's true not just in the clinic. It's true in every aspect of what you do as part of your life. And so, to your point earlier, if you upload your radiology images to ChatGPT, OpenAI now has access to that. If you have ever searched for something on Amazon, a purple sweater, and then you go over to Facebook and all of a sudden there's advertisements for all the purple sweaters that you actually don't really want, you know that this data is being shared across organizations as well. And so just think very carefully about how you are making your health information available, not just in the clinic, but as part of your everyday life, and how that may trickle down to other organizations or other actors who might have access to it.
That's such a good point, especially we've seen some of these breaches and bankruptcies like 23andMe. They have some of the biggest database of DNA on the planet or something, right? That's scary, what they're going to sell, who they're going to sell that to. Extremely scary because they know genetics, defects, et cetera, et cetera. And we did not sign up for that necessarily. So it's scary to know that data can be sold to anybody. And it's really important to read the fine print.
Yeah, and that's not anything that's new. It's just that the ways in which information is being able to be synthesized is just growing and becoming more sophisticated, and so we're now seeing it in a way that we didn't, a decade or two ago. The same data harvesting was happening. It was just less visible to us.
So would you say your advice is just be intentional, or is there more things people can be doing?
To be thoughtful. I am probably in the minority that I read more terms of service than the average Joe before I sign up for a service. But to your point about 23andMe, like 23andMe's founders were very intentional about the way that the data was going to be collected, the way that the data was going to be used, and even with that, now that they have run into financial troubles, they may not be able to actually follow through on the promises that they made in the early days of their organization.
Yeah, Donna, the other thing I think is really important for folks to know is that AI can create hallucinations. So I don't know if you've heard that term. It's computer science for making stuff up. And that happens, in the first models was about 20% of the time. And when you see it in healthcare, it can be really sneaky. Like it'll be like a couple of sentences describing, and that sounds right. And then all of a sudden you're like, whoa, wait a minute, where'd that come from? And one of the cool things about going back to the AI scribe is I can go back and see the actual recording and the transcript. So I can say, did they really say that? Or did I miss that? So you can kind of check it. I really like that part of it. But yeah, hallucinations are a problem with any kind of AI output.
Any generative AI products generates, right? There's traditional AI, which does all this classification. Generative AI generates. Everything AI generates is hallucination. It's making up all of it. Some of it is more accurate than others, right? When it's grounded in real data and it says, I'm going to lean in on this data, it's less hallucinati. But in general, it's generated stuff. So this is why being an expert matters, because expert is able to spot, actually, this is wrong. An unexpert like us will say, that sounds legit-ish, right? It's no better or worse than reading nonsense things on Reddit forums, right? This is how you read a Reddit forum. You're convinced you have chickenpox now, right? Sorry, guys, we all have chickenpox now because we read it. So let's talk a little bit about laws and regulations around AI. I know that many of you have deep expertise in this space, just given the regulatory industry. Can you share a little bit about that?
Yeah, currently, I think the big area for us is the requirements. I'm going to go back to privacy because that really is front and center. Of course, in the work we're doing, people are sharing their innermost thoughts and feelings and experiences that oftentimes no one else knows about. Their parent may not know about it, their spouse may not know. And so unless we can really ensure that we are not just adhering to the laws that govern privacy, but making sure that we are clear with those we serve, that the information is protected, that it's confidential, no one will see it. And primarily we're serving lowest income community members who often don't feel empowered as clients and consumers. And so it's a responsibility we then hold to make sure they are empowered, that they are informed, and that they're very clear. And oftentimes that may be very marginalized individuals who are chronically homeless, individuals who English is a second language, individuals who may be undocumented. And so the fear level right now, of course, is quite high for some of those folks. And if we cannot convince them that we are adhering to those regulations and those laws, then we lose the therapeutic opportunity to serve them as effectively as we can.
Yeah, I can talk about 3 bills that were considered in the last legislature. One was around AI transparency. I think this was Representative Shavers who promoted that. It didn't get passed, unfortunately, but the AI is just such a black box. And so he was just trying to increase transparency, like what was their data source and like how often they're checking it. It was modeled off of a bill that passed in California. And then the other bill that I was involved in kind of advocating for was it was a policy that insurance companies are using for prior authorizations. So for the folks who don't know, this is kind of the bane of physicians' existence. So when we write that prescription for a medication or the MRI, the insurance company says, I don't know about that. And then we have to like submit all the justification. Well, the insurance companies have created AI to not even have a human. And we felt like there should be at least a human who's part of this prior authorization process. That also didn't pass. So the bill that actually I think did pass it's not really healthcare, but it was around child pornography. It was AI generated child pornography, and I'm pretty sure that one passed. So that was a kind of a no-brainer.
At least one of them passed. That's a good one to pass. Gosh. Okay, so there's an elephant in the room, maybe like a very large herd of elephants in the room around job loss, right? How many of you have heard AI is going to kill off all these sorts of jobs? It doesn't even matter what the job is, AI is going to kill it off. It starts with software engineers who invented AI, then doctors, then Excel users. Like, just name it, AI is going to take your job. What do you think? Is there a reality in your fields around job loss and AI? Like in the near future, right? In the future, 10 years from now, some jobs will not be a job because they weren't. Jobs change every 10 years anyway. But is there an imminent danger of a certain kind of job that you think will disappear in the next, 12 to 24 months?
I don't know about jobs that will disappear, but there are certainly efficiencies that certain AI products will help with. And so, and that is true of many, many different types of technologies over, decades of history. And so I think we may see a shrinking of the workforce. I don't think that there's going to necessarily be like replacement of all roles, but there, for instance, in the healthcare industry, there are people who come in and manually extract information from a clinical record, for instance. There are now technologies that can do that much more efficiently, maybe not completely on its own. What a term that you will often hear is human in the loop. As it relates to AI, it means that the AI isn't doing it without some sort of oversight. And so I do think there will be roles that, just like a doctor having to learn how to use a new tool, there are many different roles who will similarly have to do that. And that may result in fewer of those roles existing, but I don't foresee it being like a mass takeover of entire industries.
At least in healthcare, which is the one field that I can speak to, I don't think there's going to be an immediate replacement of the workforce with AI, but there will be a quick evolution to the different jobs using artificial intelligence. And so for example, the prior authorization example, we have a whole team of humans right now doing prior authorizations because we just need to beg our insurance payers to authorize for drugs that our patients need, right? That our physicians and our providers say that our patients need. When we try to leverage artificial intelligence to take away the more manual part of that job, we're not actually replacing these pharmacy techs that are doing the work. What we're doing is freeing them up so that they can do more important things. They can be talking to our doctors on how to document more effectively so that it gets passed or it gets approved in the first go. They could be working on denials. So those that didn't get approved in the first round, they could be going back and trying to do more negotiations and more talking with the insurance companies. And so all of that right now is a backlog because we have such a shortage of workforce just overall that we can use AI to kind of free up up all that really manual stuff to let the humans do more human things. We're also using artificial intelligence to do medical coding in some situations, and we're not really replacing coders. That was kind of a big fear when we first kind of approached this project, but what we realized is that we're not actually replacing the coders. What they're doing now is they're able to, instead of sitting there reading 20, 30 notes every day, what they can do is they can actually engage with our physicians and tell our doctors how to document correctly, and they can actually be talking to our insurance companies to actually advocate for our patients for the care that they need. And so I think there will be a change in job and probably even an elevation of everybody sort of the top of their license or the top of their capabilities using artificial intelligence.
I love that.
Well, it's interesting. As a nonprofit community-based organization, on the administrative side, we'd never have enough capacity. So there's no scenario I can envision where there's job loss, but what there will be is capacity building. And some of this is very basic, like we're implementing Copilot. We have a lot of meetings in our industry. We got to talk about everything, meetings. And so for the staff that are responsible for documenting those meetings and then creating notes from those meetings and following up on all those things, oh my gosh, their job satisfaction immediately is going through the roof because it's such a, and they can actually participate in the meeting, which is amazing. So their job satisfaction is going up as well. So I think for us, it's really going to be building capacity that's, in all our areas, human resources, finance, quality and compliance. So it'll be a capacity builder for us.
That's funny you say that because I had a meeting at 6 o'clock today and I shipped off my Copilot to attend in my stead so I could be human in the loop with all of you instead. Yeah.
Yeah, I would say like the three jobs that are probably at risk in healthcare would be like what we call revenue cycle. It's more of that back office stuff. Anyone who's doing analytics, and maybe some of our call center folks, those are kind of the most at risk. But I was watching a video recently on LinkedIn from an expert in AI. So how many of you in the room are like software engineers, software programmers? Yeah, so a number of you guys. So and hopefully you're using AI because the bane of your existence is like you write a program and you forget like that colon or the semicolon, right? And I imagine what I've heard from my colleagues in tech who are doing a lot of programming, AI has totally transformed it. Like you don't have to do all that troubleshooting. You can get a lot more of that code, and it is really good at picking up those things. But what it's allowed computer programmers to do is to think more of the architecture, and spend more time with the client, and like what's the output you want to do. So I think we're going to see more of that in healthcare too. Is like maybe less focus on the mundane and help us to work at the top of our license. Now we're going to have to retrain a lot of people. And I think the pace of change is what I'm really concerned about, that people are going to be, left without a job and not having any pathway for what they could do in the future with AI.
All right, it's time for lightning round. We have exactly 6 minutes, which is perfect amount of time to assign homework. Okay, so what I would love for everyone to think of here is we've got a beautiful, very diverse, very broad audience of people. What are some things that you would love for everyone to do in the next 6 months so they get more informed with AI, more involved, more engaged? What are some things that you think people should be doing?
So I'll get started. To be a savvy health consumer in this era of AI, ask how your data is being used. So if I walk into the clinic tomorrow and I see you and I say, hey, I got this cool thing, can I do it? A smart question would be, sure, Dr. Scott, can you tell me how my data is going to be used? Where is it going to be stored? Is it going to be destroyed? And I'll tell you, it's never going to go offshore. As soon as I sign my note, it's going to be permanently destroyed. And so in healthcare, we take your data and your privacy really seriously, and you should never be working with a healthcare provider who doesn't have that level of commitment.
Can I go next? Because you stole my first one. My homework for everyone, I guess, in the next 6 months would be to go to your favorite Gen AI of choice, so most popularly ChatGPT and Gemini and all that. Use it once or twice, but as you're doing that, just have a mental exercise of what's happening to the data that you're putting into that machine. So as an example, I'm going to give you kind of a little bit of prompting, and then you can do your own exercise after that. My parents live in Taiwan, and in Asia, about a month ago, it was really popular for people to put photos into ChatGPT, and it'll generate like an animation version of it for you. And so suddenly on my Facebook news feed, everybody's got their family photos, graduation photos, all kinds of stuff, now all sort of beautified by this animation type picture. And that looks great, and it's a trend, and everybody's using it as their profile photo. But the one thing that my parents didn't think about when they almost did it, and I stopped them, was that now ChatGPT knows how many grandchildren you have, how many kids you have, how old they are, where you're uploading this picture from, where the background of this photo is. So now they know where you've traveled to, where you've traveled with your kids and your grandkids. All of that stuff is now part of ChatGPT or whoever the vendor is. It goes back to train their product to make it better. And your data, you as the owner of that data didn't profit from it, but also two, all of your privacy is now at the hands of that vendor. So think about it. Do that as an exercise for yourself, and just think about that information that you're putting into this engine, what it's doing with it.
You all are better cybersecurity experts than my actual cybersecurity team, because that is some damn good advice, both of you. Thank you for that. Yeah.
So since you both stole number 1 and number 2 of mine, I'll flip it a little bit and try and have it be something that's a little bit more proactive. So for anything that you feel comfortable sharing and making available in any one of these tools, I would encourage you to be curious. Go play around with some of these tools. In particular, ask it questions that you think you really know the answer to. Something you're an expert in, and see what it comes back with. And understand that that is likely what other domains are seeing as well, whether that be a doctor who is typing something into a generative AI or a coder or whatever. And be curious and poke around at it. If it doesn't get the answer correct the first time, try and course correct and see if it can. So don't do it and say you were wrong, this thing is garbage. But be curious and use it as a tool. Have fun with it.
Yeah, treat it as the intern from last summer, right? Your boss's nephew, the one you got stuck with, that one, where you can't fire them, but you kind of have to try to train them and see if they can be useful in certain scenarios.
But don't do it with your health information.
Not with your health information, not with your health information. Something else, like, what's the best way to road trip to blah? That's a terrible route, that sort of thing. All right, what do you think?
Well, I was wishing I interrupted John. It was rude, but community behavioral health, behavioral health in general, we lag behind the rest of healthcare. It's been a huge lift for us to have such widespread recognition that the conditions we're providing care for are healthcare conditions, not personal failures. And it's being really transformational to move out of sort of a social service environment into a healthcare environment. And I think one of the things that I would ask is if you have any opportunity to engage, to advocate for access to behavioral health services on a wide basis at parity with the rest of the healthcare system, that's really something that we really need, is the help of community members to have a voice to say, I won't ask you to raise hands, I've done this before. How many of you have a family member? How many of you yourselves have received care from a behavioral health provider? I have. And so it is so prevalent and widespread. Just any opportunity to engage and advocate around access to proper care.
That's very powerful. Thank you. Okay, so I'm going to ship you all off on a breakout break, or Jeff is, but can we give everyone a big round of applause?
Thanks again, Donna. That was awesome questions. Thank you to our guest speakers for answering those questions. I was expecting for you guys to bring the knives out, but you guys are so agreeable. Everybody is so agreeable. So just kidding, but thank you. So we're gonna take a 10 minutes break for a Q&A session. Please mingle with someone, all the questions you might have. Please gather it together, and we'll be back. We'll take a 10 minutes. I'll be back to the Q&A session with our guest speakers. A round of applause again for them. Thank you.
There was a question that I wanted to ask and I forgot because we start yapping. But there's a lot of talk about AI usage in research and drug discovery and all of that. Do you two mind sharing? Because we're having a very interesting conversation during the break.
So I'm an infectious disease physician, and there's not a lot of money to be made in antimicrobials. So there haven't been a whole lot of new mechanisms of action, new classes of antibiotics in particular. And we're running out of options. I mean, increasingly, I have patients who, we run the tests and every antibiotic we have, it's resistant to. So there's some exciting uses of AI for that. So the MIT lab has found a new class of antibiotics, and the first one out is called Halocin. So I think that's really exciting. I think new targets for like oncology drugs or vaccines, it's totally changing the process of drug discovery and vaccine research. It's making it much faster and safer. So I think that's really exciting.
And part of the way that it's doing that is allowing screening of a lot more targets and understanding of what those targets are like biologically, where previously you may have had to do individual experiments for every single one of those potential candidates. And some of the AI models, in particular things like AlphaFold, if you have heard of AlphaFold, that has come out of David Baker's lab at UW, and many others like it, not just that one, are allowing scientists, both in academic organizations, nonprofits like ours, but also in industry, to be able to look at a lot more potential drug targets in a way that they just weren't able to do previously.
That is an amazing story. The acceleration of something where we're talking about the machine eye, right? Huge quantities of data. How do you look at it quickly with machines, it turns out, with machines?
Yes. So I don't know if did you hear what you said with machine eyes? So there's some studies looking at like hundreds of thousands of chest x-rays, and then they know what health conditions these people have. So it turns out that you can actually identify people who have valvular heart disease, which can sometimes be really serious, and even diabetes. So that's an application for population health that I think would be really exciting. If we could, we could go into our database of all our patients who have a chest x-ray and reach out to these people and say, hey, we saw something in your last chest x-ray, your lungs look good, but maybe you need an echocardiogram. And that, again, the earlier we can catch things, the more we can do.
Love it. Okay, we're ready for questions. Who's got some? All right. Jeff's going to be getting in his miles. This group.
Oh, it's
yeah.
Hi, thanks so much. This has been really great. Full disclosure, I am industry. We're here in Seattle where there's a lot of imaging. And maybe this is just playing devil's advocate. I'm not sure if there's a question in here, but maybe more of a discussion around, you just actually spoke a lot about hundreds of thousands of images. But your advice previous to the break was for none of us to share our data. And so there's sort of a bit of maybe a good friction in there about the fact that, if you want us as industry to develop these things, we need data. And we do need to make money because we are a business and we're not going to be able to provide those solutions. And so, what are your thoughts on sharing data, I guess? And, ultimately our goals are very similar to yours. We really want best things for your patients and we want to help you do that.
Okay. How do you get data without sharing data?
I'm happy to take a first stab at it. So that was a really great question and something that we struggled a little bit when we tried to implement the ambient AI tool that we spoke about earlier today, where artificial intelligence, an app you open on your phone, it captures your conversation with your physician and it generates a note for you. A struggle that we have in pediatrics is that frequently vendors and technology for healthcare develop your tools based on adult data because we have a lot more adult patients and adults are the ones that pay the bills. Pediatric data a lot of times sort of lags behind a little bit. And so part of my role now is to really advocate for pediatric innovation. But the point is, like how do I know that I'm buying a product from the vendor that has reliable pediatric accuracy because is it trained on enough pediatric data? And how do I, as a pediatric organization, expect the vendor to work with enough pediatric data, but at the same time not wanting to give them at all any of our data, right? And so that's a really great question and a struggle that we really faced. And the compromise that we ended up getting to with our vendor is that we will give you data to help you train on pediatric subspecialty terms and vocabulary and all that good stuff, but it has to be de-identified. So when we give you the data, it doesn't say Clara Lynn is this 15-year-old patient that is in the room talking to the physician. My voice is somehow masked, right? And in the transcription, anything that has any identifier about me as the patient, my name, my date of birth, my address, all that good stuff is scrubbed before that data is then transmitted to the vendor. So I think de-identifying, especially in a HIPAA compliant way, is the right thing to do when we're submitting data for the advancement of the technology.
So I swear this wasn't a plant, but I have spent actually the past 2 decades working in data sharing and open science more generally. And one of the big initiatives that we have kicked off at the Fred Hutch is something called the Cancer AI Alliance. And part of what we are trying to enable, it's a partnership with a number of large tech companies who are providing resources for us to be able to build infrastructure. Those tech companies will not see any of the data, but what we're building is a federated ecosystem across cancer centers, in particular the Fred Hutch, Memorial Sloan Kettering, Johns Hopkins University, and Dana-Farber, at least to start with. And the idea is that each one of those individual institutions they get to maintain their data sovereignty. So all of the data continues to reside within each one of those individual organizations, but there are advancements in AI and in what is called federated compute or edge compute, which allows you to in a non-technical way, send the code to the data as opposed to centralize all of the data in a singular place. And this federated learning or this federated compute, all that gets shared back with what is called the orchestration layer is model weights. So estimates of what the model is trying to do. And so it's a way in which you can make data available for research and for discovery in a way that both protects privacy, keeps the data within firewalls, but also, opens up a breadth of data that otherwise wouldn't see the light of day, both for validation purposes, generalizability, as well as to help mitigate bias, hopefully in the future. And so I'm happy to talk about that offline a little bit more too. And there are a number of industry consortiums that are doing similar things with federated learning.
So that's a really important point because there are so many regulated industries with this issue. Government, education, finance, all of these say, we're a regulated industry, we can't use a model that's used in the wild. We need our own, and that's where these federated on-the-edge models, where it runs locally inside your own company. It may even run locally offline on your own device. So that is not being trained on anything. You just use the magic, air quotes, of an AI model to do your work with your own data locally, which has been a big topic in many, many fields, especially government. You can imagine we do a lot of work with Europe. This is probably the #1 use case that you'll all hear about. But that is an option. it is an option that exists and something, if you work in that kind of field, you should look into. All right. Other questions?
Question back here.
Back here. Here you go.
Hi. It's kind of a two-part question. The first one's going to lead into the second one. Before I ask, before I ask, I am an ER nurse, and I have been for over 10 years. So my first question is, how are bedside caregivers being included in the conversation of AI development? And I ask this question because there are a lot of policies that are put forward and changes put forward by hospital leaders and other healthcare facility leaders that sometimes as bedside caregivers say don't make sense and actually makes our job harder. And that leads to my second question. The panel mentioned hallucinations, which I'm interpreting that as errors. So currently, healthcare workers, we are overwhelmed with the amount of work that we're expected to do. So if the responsibility is going to be on us to make sure that we're proofing for the hallucination so there isn't an error, what if that hallucination or error is not caught by the provider and that leads to liability? Has there been any conversations about that in protecting us who will be the ones facing the liability?
I'll get started. We talked about the ambient scribe, and it's not just physicians that are being overburdened with documentation. It's our nursing colleagues. It's estimated that nurses spend like 90 minutes per shift or more on average just doing documentation. So the next phase for UW Medicine, once we roll this out to all the physicians, will be putting this tool in the hands of nurses. And I've talked to other health systems that are doing it, and the nurses love it. The other thing that we just went live with at Harborview was what we're calling the hospital room of the future. So if you guys know the mailing building, we have 2 floors that have been totally redesigned. And we're working with a company called Care.ai for detecting falls. I mean, this is a big thing. Maybe elderly patients or patients who have had surgery, they get up and they fall and they have a hip fracture. So we're using that and trying to identify those people and help our nurses, to identify those patients. So those are 2 things. In terms of the liability, I think this is where your contracts come in. If we're going to start diagnosing, there's probably going to need to be some shared responsibility on like if anything goes wrong. And right now, the medical commission has said if you're using AI, Dr. Scott, you're 100% responsible. We've really been, as a medical community, trying to push back on that because we don't really know what's in that black box. I think it needs to be a shared responsibility.
I'll add, early on in the panel, I talked a little bit about governance in implementing AI, and I think part of that governance, at least at Seattle Children's, one of the things that we absolutely insist on is clarity on the accuracy and how well the creator of this tool ensures the accuracy and how they tested it and how they plan to continue to monitor that accuracy. So if I'm just using AI to generate a PowerPoint for me or read my emails and give me a summary, like 85% is probably cool enough, but like 85% in healthcare is not great because that means you're making an error 15 to 20% of the time, and that is not okay. And so I think at least at Seattle Children's, one is that if we are licensing a product, we need to make sure that it is meeting our very minimal standard for the use case that it's doing. Secondly, if we are developing the product and we're testing it to a T to make sure that it gets to a level of what we think is appropriate. And then to your point on the bedside care, I think, and also kind of the 2 questions being so related, healthcare workers are so burnt out these days, bedside nurses, physicians, providers. And so one of the things that Dr. Scott mentioned in the documentation, one of the things that we're now looking at is the cognitive burden for a nurse or a physician generating that documentation higher than that same nurse or doctor reviewing and editing that documentation. And so the time that I'm taking to write a note versus the time that I'm taking to edit and proofread a note, which one is more of a cognitive burden, and are we actually relieving any burden by using something like ambient scribing or computer vision to help you do the documentation. So I think we're so early in all of this. That is definitely something that we need to study and see if this is even promising or even useful to our bedside staff.
I would just add from behavioral health, I think our challenge is that the documentation of the services we provide can vary widely and oftentimes create liability risk. And so for us, I think it's going to be the opposite. I think this will be a great assist to staff to be able to generate notes that are in compliance with the voluminous regulations we have, which are many, many, many. So that's our hope. And similarly, we will start with starting with a group of staff and making sure we really understand, is this what we hope it will be in terms of enhancing the client experience and the staff experience? And the last thing we want to do is add more burden to our staff, for sure.
I'll just really quickly add that we have a small team at Fred Hutch that focuses on human-computer interaction. And part of what their job is when, in particular, we're developing a new tool that might be used, for instance, in the clinic, you do role mapping of all of the people who are involved in that potential process and use of that technology, and you interview them. You ask them questions about how they would use such a technology, what they would want to see, et cetera, such that the design of the product that is being designed in that case includes all of the key stakeholders of what's going on. Now, that doesn't necessarily get to if you're buying a commercial off-the-shelf product and trying to deploy it in the clinic, but it is another sort of tool in the toolbox and set of expertise that we try and bring when we're developing something de novo.
So one of the things that's interesting to help with your question is that the AI models are getting better. The latest set of models are called reasoning models. In normal people words, they're models that have gone to therapy. Okay, so unlike your ex, they know how to fix your own problems. Okay, so how it works is there's one model and a second model working in the background to say, actually that's wrong, fix it. Actually that's wrong, fix it. And you can even prompt the models or AI tools to say, only highlight areas or that you're not completely sure about. You can actually ask it. You can say, give me an answer only if you're 100% accurate. And you can test it, right? You can say, like, again, the homework we were given. Go ask a question you know very, very well, and then say, only give me the most accurate answer, highlight the sections that might be wrong. So kind of test these things with your own scenarios, because you will only boost confidence when you try it and see it for yourself across the board. Next question, what have we got? Oh, okay, here we go.
It feels like there's an underlying assumption about data harvesting and privacy loss being inherently bad. I'm just curious what you feel like the root fear is behind those assumptions.
Oh boy. I could speak for myself. I think we have seen, in particular, marginalized groups in our society being targeted with the improper use of data that has been made available to actors that they did not explicitly consent to have access to. And from my perspective, that is my biggest worry, that we're making the most vulnerable more vulnerable. And that comes from somebody who is a data sharing advocate, an open science advocate. And so I think we just need to be really, really careful about the systems we're putting in place and ensuring that that while many of us are trying to do good, we need the appropriate guardrails in place to ensure that others aren't being harmed.
Yeah, I think healthcare is just intrinsically a conservative business. So there's three concerns. Number one is just trust. We never want to lose that trust with our patients. Second is money. If we violate HIPAA, I mean, the financial penalties are significant.
Yeah. And I lost my thought on the third one, but those are two big ones.
For me, I think it also relates back to the first question in our needs to advance the technology and innovation using data, but at the same time protecting the privacy. There's some things like in the example that I gave with my parents using, putting family photos onto ChatGPT. There's some photos that are totally fine, right? To do it like my own photo, my headshots, if I want to make it better or change the background for professional uses, that's probably okay. And so there's some data that is totally okay to share, but there's some data that is not. And how do we share it intelligently, smartly, using a federated model and a de-identify way? That's totally safe to do. And how do we? I think the key thing here is, as a consumer, how do I know when to consent to the use and the sharing of my data and when not to consent?
Okay, good. Raging debate. I like it. Okay. Next, we've got some takers right here. Yeah.
Yeah, you guys talked about a little bit about disclosing to patients the use of AI, which is absolutely true. My question is, in your organizations within the healthcare system, how are the internal people receiving the advent of AI, and what are you doing to allay people's fears or encourage people to use it and make them understand how it can be used?
Yeah, but I guess I'll start. I've been overwhelmed at how much the staff are embracing the opportunity to use AI. I think some of that is we have many student interns that come in and intern with us. That becomes a great opportunity to hire them when they complete school. So we have a very significant part of our workforce that are young in their career, and their comfort level is just very high. And so I think it's been surprisingly, overwhelmingly positive, which I was not necessarily expecting. Yeah.
I think in the last year and a half, when we've been developing our own AI tools and also implementing some commercially available ones, I see the fears that you're describing tend to be one of two things. One is, am I helping you implement something that's just going to take over my job in 6 months? And why should I do that? Why should I participate in this work? And then the other half of the fear goes back to the bedside nurse question. We're already so burnt out. Why are you putting on more things for me to verify if the technology is correct? And what is my responsibility when something goes wrong, right? And so and how do I know that I can trust the machine, or how do I know that I can trust the artificial intelligence? And so I think we have been really working with our staff, and in terms of the first fear that it's going to replace their job, and really just showing them that this is really to augment your workflow. We're here to help you work faster and not do all the boring stuff that you really didn't really want to be doing in the first place, and take all that boring stuff away from you so that you can focus on the things that you do want to do and the things that you are trained to do, like a physician and a nurse, and even a medical code or rev cycle and all that, all those roles. And then into the second half of the workforce that are concerned about sort of how can we trust that this technology is going to be accurate, and I'm not going to be putting in any more of my hours to train it, to help you train it or make sure that it's accurate. I think there's that explainability of the AI. How do we, how do we help translate that it's a reliable model, and how does the vendor help convince us that it's a reliable model? So just being super transparent to our workforce has been a really helpful way to get them involved.
So not to be nosy, but how did you train them? Did you have sessions in the office? Did you give people homework to do, just tactically?
From a implementing of artificial intelligence, yeah, because of this concern, actually, we involve at least a few AI use cases that we've implemented so far. We involve our staff even before implementation. We invite them to come and evaluate the products with us. We have them do sort of the vendor search with us, and then once we've picked a vendor, we have them come and take a look at the sort of behind the scenes with us, validate the tools with us if they have time, or if they send a representative or a leader to come, and this leader then goes back and kind of help us communicate that message back to them. So we really involve our staff really early on in the process so that everybody is part of the work. And then if we don't trust it as an organization, we don't do it.
Okay, awesome. You bring them along. Next. We have time for like 2 more questions.
Who was first? I didn't see who was first.
So you've mentioned protecting the vulnerable and the marginalized, but what I'm excited about with AI in healthcare is the ability to really improve care for people who are at greatest risk and maybe don't have access to the highest quality insurance. So do you see any potential opportunities for AI reducing barriers to healthcare access for those people, and how?
So we were talking beforehand, and we call this the magic wand question. Like if we had one wish and we wave the magic wand. So this is my magic wand wish, and that's to use AI for translation, because the standards for medical grade translation and interpretation are pretty high. But practically speaking, a lot of my patients, they're just using Google Translate. So one of the things that Clara is doing at Seattle Children's is doing a pilot study on AI for medical grade translation. That's something I think could really improve the disparities and just having that data without having to go to Google Translate.
I spoke earlier about a tool that we developed called Pathway Assistant, which is basically layering the AI chatbot over the thousands of pages of clinical standard pathways that are evidence-based, constantly updated by our human experts. That tool without AI is downloaded worldwide. I mean, in resource-limited countries that want to know how to best treat asthma or how to best treat gastroenteritis, they can leverage this pathway right now on PDF. But if we really, we're currently in the clinical validation phase. So we've tested the model for Pathway Assistant. We know it's 98, 99% accurate in the testing site. And now we're actually going to be using it in clinical care. If our clinicians use it and they accept it and they think that it's actually useful, this is a really great way to democratize this knowledge to everybody who is not a tertiary pediatric center that want to be able to take care of children anywhere in the world.
Yeah, just to add on to that briefly, I think in a lot of low resourced areas around the world outside of the U.S., there are extreme opportunities, in particular as it relates to supporting community health workers in very remote areas, to give them access both to information and to knowledge about how to navigate a care session or a series of follow-ups that need to happen in a way that just didn't exist before.
Okay, so we are reaching kind of the end, but a question was brought up earlier on the break about AI tools. So if you don't mind me stealing your question, what AI tools specifically by name if you can disclose, are the ones that you all tend to use in your practices? Yeah.
So for back office work, we're partnered with our telehealth partner that we've been working with, who has developed non-clinical tools around really supporting human resources, quality, compliance, policies and procedures, which we've got up the yin-yang, so all that work. And then we're, of course, using basic tools like Copilot, figuring out best uses. There is a company that's emerged nationally that's also got a close partnership and relationship with our vendor for our electronic health record. Their name is Elios, and they are really becoming the leader in the behavioral health field around particularly the clinical note scribe function. And we're still in the process with them.
We are this coming year looking at leveraging Epic, our electronic health record, and their sort of foundationally developed artificial intelligence models. So that would be a big focus for us. We've also been working a lot with Google using Gemini to develop tools like Pathway Assistant and a couple others that we're working on right now, working with Microsoft Azure to do some of our translation work, and then working on quite a few research studies with AWS and their artificial intelligence. And we're doing also like non-sexy stuff, like predicting where we're going to be short on supplies and when shipments will come and not come. And so that I cannot remember what the vendors' names are.
Yeah, so we're working with Microsoft. So we use Copilot, and all of our teams meetings we'll use the note-taking feature. For the ambient scribe, we're working with a company called Abridge. They're out of Carnegie Mellon and University of Pittsburgh. Have a pilot with Evidently, and they kind of like, it's a service that does chart spelunking. We talked about those 1,000 pages. It can help find that information for us. And then Care.ai, which is our virtual nursing product.
And at Fred Hutch, we have partnerships across the board with basically every single large tech company. In particular, with the Cancer AI Alliance, we have a partnership with AWS, Microsoft, Google, NVIDIA. They're all part of the alliance. I'll leave this on a little bit of a lighter note. I used ChatGPT to generate the photo for my fantasy baseball team last year, which is called the Penguin League. And all I did was type in, give me a cartoon penguin playing baseball with the number 24, so it was 2024 season, and the name of the winning team on the back of the jersey. And I got a really cool photo that I got to share with my fantasy baseball team.
The answer is Penguin AI.
Yes.
That is the tool.
Yes.
Penguin AI.
And this goes back to the go and play with the tools. They are fun tools. Be cognizant of what you're putting in there, but also explore some of the possibilities too.
Yeah. Do non-data heavy activities. Just see what they're capable of and see what they're not capable of. I think probably the most useful thing for all of you, these fine folks are what I call AI power users. They're the ones who are reshaping their industry using AI and saying the future researcher will do this. The future doctor will be like this. The future just healthcare professional will be like this. They're the ones defining the next set of roles. They're not saying, oh, some bro in Silicon Valley is going to define it. No, they're not. They're going to be defined by people who are experts in the field. And I really encourage every single one of you to become an AI power user in your field, because you don't want some random person to decide for you. You want to be the one saying, this tool is good, we should all use this, like these folks are doing, rather than having it handed to you one day, which is what will happen otherwise. So can we give a huge round of applause to this amazing panel?
Thank you, Donna. Thank you to our speakers. Really appreciate you being here and answering all the questions. I want to say a big thank you to our Civic cocktail sponsor, Comcast. Please, you will get an email for evaluation form in your email to fill out evaluation after this. We're looking to always improve our program, so please give us feedback, fill out the survey, and we would like to take your input. Also, please join us for our next event, which is June 4th, next Civic Cocktail. We'll be talking about livability and cost of living in Seattle. That'll be our topic. I think that's a topic on almost everybody's mind. So please join us for that event next month, June 4th. Also, thanks again to the staff of the collective, News Media. Thanks again to Jeff. Please give a round of applause for Jeff. Jeff has been our program manager, so he's one that's putting all this magic together. So thanks again, Jeff. And thank you all for attending. I appreciate your presence, and thank you for the board members that are also present. Good night.